Welcome all to the second presentation for COVID-19. In this presentation, we will talk about best practices for COVID-19 in the workplace. The Department of Employment and Labor has issued formal directives and regulations that requires the employer or workplace to provide and maintain as far as is possible a working environment that is safe and without risk to the health of the employees or workers. So the workplace has to put in place measures and responses to prevent the worker from contracting or spreading COVID-19 in the workplace. So although it is the responsibility of the employer or workplace to implement these measures, it is also the responsibility of the employee or workers to comply with these measures. In this presentation, I will talk about facility requirements, administration measures, the response plan. And here we will be looking at the procedure once the employer has symptoms comparable to COVID-19 when entering the workplace or during a workday, the procedure once the employer experiences additional symptoms when entering the workplace or during the workday, the procedure once the employee tested positive for COVID-19, the procedure for high risk, confirmed COVID-19 exposure asymptomatic, and the procedure for low risk, suspected COVID-19 exposure asymptomatic. Facility requirements. The workplace must ensure that there are sufficient hand sanitizers, paper towels, and not fabric towels. Each employee must be supplied with 2 cloth masks. As far as possible, ensure social distancing of 1.5 meters between workers, demarcating working or seating areas. Supply the workers with face shields, visors, or physical barriers if a social distance of 1.5 meters cannot be maintained between workers. Signage of COVID-19 contact details must be visible. Training should also be done on COVID-19, including how it spreads, signs and symptoms, hand washing and hand sanitizing, how to use and handle your cloth mask, and social distancing. Additional cleaning procedures should also be implemented, such as all workplaces must be cleaned twice a day or every 4 hours. The focus should be on common areas such as toilets, door handles, and shared electronic equipment. All offices should be well ventilated. All employees should be screened twice a day for COVID-19 symptoms before they enter the workplace and prior to the end of the shift. All employees should be screened for additional symptoms twice a day before they enter the workplace and prior to the end of their shift. All volunteers and members of the public who enter the workplace must be screened. Now, the employee must ensure that the employer has implemented all the facility requirements. They should practice hand washing and hand sanitizing. They should keep to social distancing. They should practice good hygiene by coughing and sneezing in their tissues or elbows. They should handle their mask correctly and ensure that good ventilation is done by keeping the doors and the windows open. They should also ensure that screening is done twice a day in the workplace. Administration measures. The employer has to do a work risk assessment for the workplace and employees. They have to appoint a designated person who can address the concerns about COVID-19 and keep the employees informed. They should minimize the numbers of employees at a given time at the workplace through rotation, staggered working hours, shift systems, and remote working arrangements or similar measures to achieve social distancing. They should put in place measures to minimize contact between the employees and the public, and they should supervise social distancing in the workplace. The employee has to ensure that the administration measures are implemented by the employer and at all times maintain social distancing. The response plan. Here I will focus on the procedure once the employer has symptoms comparable to COVID-19 when entering the workplace or during a workday. The procedure once the employer experiences additional symptoms when entering the workplace or during the workday. The procedure once an employee tested positive for COVID-19. The procedure for high risk confirmed COVID-19 exposure asymptomatic. Asymptomatic means no signs and symptoms. The procedure for low risk suspected COVID-19 exposure asymptomatic. The procedure once the employer has symptoms comparable to COVID-19 when entering the workplace or during a workday. All employees will be screened for fever, dry cough, sore throat, shortness of breath, or difficulty in breathing. Should an employee present with any of these symptoms, he or she will not be allowed to enter the workplace, provided with a surgical mask and referred for a COVID-19 test. Should the employer experience and report any of these symptoms during the workday, he or she will be isolated, provided with a surgical mask, and referred for a COVID-19 test. Their workstation and areas around it will be disinfected. The procedure once the employer experiences additional symptoms when entering the workplace or during the workday. All employees will be screened for body aches, headaches, redness of the eyes, loss of taste and smell, nausea and vomiting, diarrhea, tiredness and weakness. Should the employee present with any of these symptoms, he or she will not be allowed to enter the workplace, provided with a surgical mask and referred for medical treatment. Should the employer experience and report any of these symptoms during a workday, he or she will be provided with a surgical mask and referred for medical treatment. The procedure once an employee tested positive for COVID-19, the employee will be placed on sick leave and the workplace will be disinfected. There will be an investigation on the cause, including any control failures, as well as a review on the risk assessment to ensure all controls are in place. The employee can only return to work 14 days after the test results when he or she is clinically stable and had 3 days of no COVID-19 symptoms. Before the employee are allowed to return to work, he or she will have to undergo a medical evaluation confirming that the employee has tested negative for COVID-19, should wear a surgical mask at all times, and continue to self-monitor for a period of 21 days after the initial test. Adhere to social distancing, hand hygiene, and hygiene practices. The procedure once an employer tested positive. A designated person will assess all employees who have been in contact with a positive COVID-19 employee and assign the employees to either high risk or low risk. High risk confirmed COVID-19 exposure asymptomatic means you were in close contact with a confirmed case within 1 meter and without facial coverage. Low risk suspected COVID-19 exposure asymptomatic means you were 1 meter away from the COVID-19 confirmed case without facial coverage, or you were within 1 meter but wearing facial coverage, or the COVID-19 confirmed case was wearing a surgical mask. The procedure for high-risk confirmed COVID-19 exposure asymptomatic. The employee will be sent home and asked to self-isolate for 7 days. The employee will be referred for a COVID-19 test and have to submit proof of testing to HR. The employee will have to do a self-symptom check twice daily for 14 days since the last COVID-19 exposure. If the test is negative and the employee is asymptomatic, he or she can return to work on day 8. If the test is positive, they have to follow the procedure once an employee tests positive for COVID-19. The procedure for low-risk suspected COVID-19 exposure asymptomatic. Continue to work but self-monitor symptoms and temperature twice daily for 14 days after the last exposure to the suspect case. Obtain COVID-19 test results of the suspect case. If the suspect case was positive, but the employee wore facial coverage, he or she can continue to work. Should the employee develop symptoms, follow the procedures once the employee has symptoms comparable to COVID-19. If those test results is positive, follow the procedure once an employee tested positive for COVID-19. To conclude, it is both the employer and the employee's responsibility to limit the spread and the contracting of COVID-19 in the workplace, and it can be done through practicing hand hygiene and cleaning measures, wearing your face mask, practicing social distancing, and looking after yourself. Please do not hesitate to contact me if anything on this video presentation is unclear or if you require more information. You can reach me at Samantha@pebblesproject.co.za. Thank you.